Sure. So the guideline is very extensive, and it is open access and now available for everybody to use in their standard clinical practice. But you are correct. We continue to perform more and more transplants every year, and we also continue to do a lot better at transplanting patients in terms of improvements in overall survival. So we anticipate larger and larger numbers of long-term survivors. So it's really important that all of us are aware of the specific long-term side effects or late effects that they may be at risk for. And every patient has a unique set of predisposing factors and complications post-transplant that put them at risk for those late effects, as well as what they receive for treatment. So there were a number of different updates in this guideline compared to the prior one. It would take a really long time for me to go through all of them, but a few of the things that I updated at the talk at EBMT were the addition of a number of sections to the guideline, including a focus on hematologic complications and how those should be monitored long-term. There were also a number of updates on how surveillance for subsequent malignant neoplasms should be approached, specifically when assessing for the development of complications such as colorectal cancer or squamous cell carcinoma of the head and neck. So I would like the reader to pay particular attention to those. We also substantially updated our sections on cognitive function and quality of life assessments long-term. So we have also come to recognize more and more that what is important to the patient's quality of life as they're living for decades post-transplant really becomes critical. So we provide some recommendations for assessments on quality of life, patient-reported outcomes, caregiver and spousal support, as well as cognitive function post-transplant. So really wanting to make sure that attention is paid to those sections as well.